I'd like to welcome everybody to our webinar. My name is Edward Shin, and I am the CEO and co-founder of QReviews. And we are a company based in New York City that helps health systems, health providers, any healthcare organization engage with their patients so that they can have a smoother patient journey. It is my pleasure today to welcome the team from Resilient 7. And I am going to just do brief intros, and I'm going to turn it over to the team here. But Vicki Reiser, Joe Zimmerman, and Leah Martineau, welcome to our webinar. It's great to have you.
Thank you for having us.
So I'd like to just keep this really organic and conversational. And as we're speaking to the attendees, if you have questions, please feel free to ask them in the chat box or in the separate Q&A box, and we'll have our audience, our speakers, address those questions. So the topic for today is nurse burnout and moral injury. This is no secret. It's a problem. It's a crisis. So we're not going to talk about, is there nurse burnout? Obviously there is. We're going to focus today on what we can do to mitigate it, improve it, and hopefully prevent it in the future. So I would love for Vicki and then Joe and then Leah just to introduce yourselves, what your background is as a nurse, and then we can go right into what Resilient 7 does. So I'm going to turn it over to you, Vicki. Tell us a little bit about yourself.
Great, thank you. My name is Vicki Reiser. I am the founder of Resilient 7. I am a nurse practitioner by training, and I work in oncology. I've always worked in oncology, and I spent 5 years as a bedside nurse in a tertiary care academic hospital throughout all different types of oncology care, from transplant to solid tumor, benign heme as well. And now I still work in oncology, specifically transplant, and then our oncology emergency department. So I'll get a little bit of both. And I founded Resilient 7 about a little over a year ago now, and it's based on, and we'll get into it a little bit more, but a lot of work that I did as a bedside nurse and throughout my graduate program to understand what compassion fatigue is, what burnout is, but also the systemic factors that interplay into burnout and how we can address it from the bottom up, and as well as with a better understanding between leadership and the front line. And I will also pass it on to Joe, who I've known now for about 5 years. We went to school together as well.
Great, thanks.
Yeah, thank you, Vicki. It's always been a pleasure working with you and also studying with you. I'm Joe Zimmerman. I'm a nurse by training. I did my clinical experience within a critical care and emergency department, two predominant areas that have pre-COVID high rates of burnout for both physicians, nurses, and all clinicians, but transitioned out into more of a quality and patient safety focus. I'm a certified professional in patient safety and have a lot of work and expertise around looking at the impacts of patient safety and then really seeing what the burnout has done to impact that for our patients. So really excited to be part of this conversation and appreciative of you and the team to bring us on.
Great, thanks, Joe. And Leah.
Another nurse, been a nurse for the past 15 years, just like Vicki. I've always worked in oncology. Something that really forged my experience as a nurse, and what really brought me into under the fold of Resilient 7 was my own experience with burnout. I think all the assignments that I've had as a new grad when I started to work were replacing people that were out on burnouts, and definitely seeing how the distress that working in oncology has put on the workers over the years, even before the pandemic, has been something that's been really close to my heart.
Great. Thanks for the intro, guys. So I'll turn it back over to Vicki. So you started Resilient 7 not too long ago. Tell us about what Resilient 7 is and what it aims to do.
Right. So at its core, Resilient 7 is both a coaching program and an advocacy platform for the frontline nurse. And it operates on what we call a cloud. And so how it functions is there is a curriculum that a nurse or user will walk through taking them through 7 concepts of resilience that we'll talk about a little bit more in depth. But from awareness is the very beginning of that, all the way up to their purpose. And this talks about outside of work as well as inside of work, because a very core piece of this is understanding, there's more to you than just being at the bedside and being a nurse. You have a very holistic part of yourself that comes to work and also goes home. And this program is also very holistic in that sense. And so by receiving this cloud-based programming, there's a text message that's delivered to